Nikhil, we're coming to the second part of this, digging a little more deeper into what your study implies. I'm now reading from your study, where you say that the causes for stress amongst the residents is insufficient faculty involvement, insufficient time allotted for formalized teaching, conflict with colleagues, and lack of adequate support staff. All of this correlates with resident burnout.
Yeah.
I'd like your thoughts on that. A lot of it seems to be institutional factors.
Yes, absolutely. Almost everything here is institutional. The survey had got multiple factors in it. And this is the opinion of the residents as to how they perceive what is the cause of their stress.
Right.
So these are the reasons which have been enumerated by the residents per se through the drop-down menu. And I think they are fair enough because what the residents, think that if they want a one-on-one interaction with the faculty, which is not always possible, or probably the faculty is not inclined that much to give that much amount of time towards that particular resident or towards resident training, academics to the residents perceive it that way, that probably the faculty should be more involved in teaching, in one-to-one teaching, rather than just going on in a routine manner, just operating cases and residents assisting them. So yes, these are the thoughts perceived by residents. And once I realized that this is what they perceive, and since this study was again published in Indian Journal of Plastic Surgery, I again presented it at multiple forums, including our national conference, so that other plastic surgery faculty are also aware that these things are going on. And since these things are happening, since these are the thoughts of the resident, as faculty, it is our responsibility to address these issues and see that the newer generation, the newer batches of residents don't actually feel that way. So we try to address those things. We try to make the working environment more cohesive. We tried to be more easily approachable, easily sort of address their queries, whatever they have, be it personal, be it professional, because since they are away from home, we are their family, and it is sort of our duty to address whatever issues, whatever problems they have. So yes, that is one way we try to address that issue. Again, one more interesting thing which came up, this was a part of the second survey. Residents felt that faculty is one of the causes for their stress. Faculty in academic practice felt the round way. They felt residents are a cause of their stress.
Okay.
Residents don't work. Residents don't come on time. Residents don't talk to patients in a manner which they should be talking. They don't write notes properly. They don't do dressings properly. And obviously, as a faculty, the responsibility is mine.
Yes.
If something bad happens there, nobody is going to go and question the resident. So residents were also a cause of stress for the faculty. That is another interesting thing which came up. So I think it is a multifactorial and intricate thing which needs to be addressed.
That's very interesting, Nikhil. So I had two questions coming from it. One was, if the residents perceive that the faculty are the source of stress and the faculty feel that the residents are, isn't there a need for some sort of a dialogue in there? Because surgery is about teamwork. And, how can we get a team to function efficiently? That was one question. And the second bit, if I can rush on, is, do you think this is only limited to surgery and plastic surgery, or would you think it's a wider problem?
So coming to your first question, yes, obviously there is a need to address this issue at whatever institutes it is. I don't think it is a universal phenomenon, but there are certain institutes where obviously this is happening. Since the survey is anonymous, we have got no way of knowing as to which institutes it is happening. But in our institute, not only in my subject, in all other subjects, and I think this has been happening across Maharashtra, It's a state in India where the medical university is placed for the medical education department. So here we have mentors, official mentors being allotted to each and every student. So if, for example, if a department has got 10 faculty and 20, 30 residents, we have one mentor for 2 to 3 faculty, 2 to 3 residents. And that mentor is supposed to be accessible, approachable, sort of given the responsibility of those residents. So that is one way, I think, which has been, this issue has been addressed at the institute management level. So this is not at the department level. The guidelines have come from higher ups at the institute level. So I think that takes care of the gap. It is one way of bridging the gap between the residents and the faculty. And coming to the second question, whether it is specific only to plastic surgery, I think it is not. And the larger the department, larger are the problems. That is what I feel. Plastic surgery is a smaller department. All super specialty departments are smaller departments. We have either not more than 2 to 3 faculty per department, not more than 2 to 3 residents per year coming to us. So my department has got 6 residents in all, 2 per year. So it is a small number. So we are a close-knit sort of like a family. But for example, Department of Medicine, Department of Surgery, there are 20, 25, possibly even 30 admissions per year in large institutes. So in 3 years, they amount to almost 100, like undergraduate batch. So it becomes difficult for the faculty even to interact with this huge number of residents. So I personally feel that this problem is much more in larger departments. Probably is much more in larger departments as compared to smaller departments, super specialty departments.
Thank you, Nikhil, for those questions, and we'll now move on to our final part.